Double.
Okay, so we'll do single hand.
Single head, okay. Ready to work, and then do it again for double hand. All right. Now Doc's just going to verify we're working on this too. Okay, that's better. Gauze to wipe the gingiva, make it dry from my topical layer. She puts the ring on my thumb and my fingers until I grab it. All right, getting patient numb. I don't remove the cap because it's just less chances of getting poked while we're just working and practicing. Do a rinse because that medicine tastes horrible. And we have topical gel and it probably doesn't taste like strawberries either. Next, she turned off the light because it is better to have natural light when doing a shade. So if you could take your patient outside, especially if you're doing a front tooth, that's probably the best time you'll get the shade because of the natural sun. If we leave this on, it's kind of like a yellow hue, so I have them turn off the light. Don't move the light, which means the light's still on and you're just shining it a different way because the hue still is going to come here. So always turn off the light. You'll get a better contrast of color when you do a shade, guys. So what we're doing is matching the tooth to the crown that we're going to make, and we want to make sure it matches perfectly because obviously it's going to be a front tooth, and you don't want it to be a different color, like maybe yellow or gray, and it will stand out like a sore thumb. So I always want to turn off that light. I'm just going to say check. I'm going to stop you real quick because I was always taught, yeah.
You guys out?
Yeah.
Okay.
So always take the shade guide out. So most people are about a shade A2. This is kind of what universal shade everybody is. So if you're lighter than that, you can go to a number 1. Or if you're darker than that, you can go to a number 3. Always take your shade guide single out. You want to take it out because if you do this number, I'll show you real quick. If you do this, your eyes will then coincide with all the colors and you're not going to be precise. Just like a shade guide just going like this. The blue bib is actually serving a purpose if you didn't know. Most of the time, most offices have blue bibs because it's like if you go shopping for perfume, they give you coffee to change the smell, right? Well, blue actually changes the eye color and then you can see again. So if your eyes get tired and it looks like everything is blending together, look at the blue bib for a second and then go back in. So that's kind of how to reset the eyes.
Looking like
A2? Okay, she's going to write A2 on her lab sheet, because remember crown prep, you want to pull out your lab slip. Okay. Then we want to take a preliminary impression. We're like a cooking show, so I already have it ready to go for you. This is a preliminary impression. So it's already made. But you're going to pass Blue Bite, and then you'll squirt it on a tray. And this material only takes 60 seconds for it to get hard in the mouth. So we'll squirt it on the tray, put it in the patient's mouth. We take a preliminary impression. Please write prelim, because there's another P word we use, and that's called provisional. Provisional is AKA crown or temporary crown, and prelim is prior to or before we prep. Okay, so we're going to take our prelim so we can fabricate our temporary crown from.
So we have a prelim.
And then you always want to try this in so the patient feels this at least one time. So try this in, have the patient bite with no material in there, and then now he knows what that feels like when we put this in, because if he bites wrong on this tray when we do a final impression, it will throw the crown bite off completely. So you always want to make sure you say bite normally, because it's funny, watch, when you go into an office, you tell a patient to bite down, they bite. And you're like, where did that come from? No, bite normal. And they're like, is that how you normally bite? Oh no, I bite like this. You'll get that all the time, I promise. So I always want to practice them biting down. Okay.
Okay, so we tried tray and thermal impressions were taken. And now
So now we need to isolate. So this not only keeps the lip out of the way, it's going to isolate the area so I don't accidentally cut that lip when I'm working.
just one.
Yeah.
Okay.
One for the maxillary buccal, and then we do 2 for the lingual, 1 for the buccal on the mandibular. Alright, first thing I'm going to do is gain access with my high-speed 557 burr. That's your Fisher. I got cords on my stuff. So in this process right now, if I use a 557, there might be decay present, or we need to remove something. Don't forget my light. So we're going to gain access to the tooth, prep. And then let's see, let's move you. Yep, right there, perfect. Okay, so now I'll use my slow speed round burr. Once that's complete with my high speed. Again, we're removing decay now at a slower rate than a high speed. Okay, ahead and rinse. Then, okay, so then, in your office, your steps don't tell you this is about to happen. So if we use a Fisher burr or a round burr, we have to build the tooth back up to what we removed. So we'll do another filling in here. So we'll add a filling to that. So that's called a buildup. Okay, so we'll build the tooth back up to whole because we had to reduce some. And then now we'll switch to a diamond burr and prep for our crown prep. So then the tooth will look like this shape. Alright, I'm like a cookie show and we're ready. Done. So now we look like this. So the way I demo this is our patient prep. My head is the prep, my shoulders are the margin. So we want our crown to sit flush with my shoulders. So that's how I refer to a margin. So it's the flat part like the shoulders, and my head is the prep. So that's what that looks like, okay? Okay, now that we're done prepping, we're probably going to change this because this is soaking wet. Change the cotton roll. Then my assistant's going to get ready. She has our cord already pre-soaking in Hemodent solution, which is stopping blood. So she's going to pass me my cord.
Okay, sorry. Looking at
We're on
this.
number 15, 16?
Number 12. We're on number 12.
Oh.
We just finished the round burr.
Oh, okay, sorry.
You're okay, sorry.
I'm jumping ahead.
I was like, okay, did I miss something?
Oh, yeah, I
Okay,
did. Sorry, we forgot to pass the spoon to make sure we have everything we needed to remove. We jumped way ahead. Okay. She keeps the gauze in her hand because if I am spooning anything out, she's going to wipe my instrument.
No, so
the hatchet?
spoon. Go to the hatchet, right? The hatchet.
It's broke. And the hatchet's the planing instrument to make everything smooth or level.
Okay.
And then rinse and dry, right?
Yep, nice dry.
Unless you rinse, you just need to put the... Okay. Probably put another cotton roll in. Cotton roll is protecting the lip and keeping that tooth isolated.
So we've done the place.
So we placed the cotton roll, now we're going to pass the cord. She's going to pass it in a certain way. She's actually going to loop my cord So it's ready to go on the tooth. So she has it looped for me. This Hemodent solution doesn't taste very good as well, so you want to isolate with that cotton roll, don't forget. And you want to be careful when you rinse it off or rinse out the mouth, because then you'll put this nasty stuff on the tongue and oh, your patient's going to be like, bleh. So we're going to pack the cord all the way around the sulcus. The sulcus is the free gingiva area right closest to the tooth. And it looks like my sleeve, and so I'm basically packing it all in here. What does this do? Who can tell me what cord does?
Provides
Stops.
clear margins.
Yeah, it provides clear margins so I can see during my final impression, because I just created my shoulder and the crown sits on the shoulder, so we need to make sure that crown that we're going to fabricate is going to sit directly on that shoulder and be flush with the edge of my shoulder. This process takes a few minutes for the doc to pack the cord in the sulcus. Sometimes the sulcus is super tight. That means this patient has gingiva. Sometimes you'll see gingiva stick out like that, and then it makes it really easy because that's bad, unhealthy gingiva. So it just depends on what your patient has. Okay. Okay, so cord is packed. Wait 5 minutes is the time. As she passes me the cotton pliers to remove the cord from the sulcus. So 5 minutes passed. How do I remove my cord?
Slowly in a circular motion.
Slowly in a circular motion. That is a question. A final question and answer. 5 minutes and slowly in circular motion. And I get an Explorer because I can't get it out. So I'm deviating from your checkoff sheet. I packed the cord really well and I couldn't see the feet. So I had to use an Explorer to pull it. And these cotton pliers.
Oh, yeah.
Okay, slowly in circle motion and it's out. When we pack this into the sulcus, you're going to create bleeding because you're probably pulling the sulcus to be like this, okay? So you want to rinse and dry, completely dry, because any moisture or blood is going to ruin our final impression, and that's what's next. So I don't know if that's listed. Please add that if it's not, because that is a requirement for me if I check you off. Alright, so she completely dried my tooth. My tooth is dry. Let's change the cotton roll again. Isolated the tooth. Patient stay open, because now we're going to get ready to take an impression. Alright, so this goes around the tooth. And she's going to load the tray. So we're going to end up looking like this when we're done. So we're like the baking show. We're already ready, okay? So I'm going to squirt this all around the gingiva and in the sulcus. She loads the tray with the pink stuff. I put the pink material in. This takes about 5 to 6 minutes for this material to get hard. So patient's going to bite normally on this tray. Material gets hard. Don't forget to pass that back. Okay, material's hard. Now doctor is going to look at the impression to make sure we got everything we need. We can see clear margins. We can see the tooth. I have a really good one I want to show you. So while she rinses, I'm going to find that. Will you look in that blue box? Those are all posterior?
Yeah.
Oh, man. Is there a final impression in there?
No.
Oh. Okay, this is what's going to actually get sent to the lab. I'll find what I was looking for. So this is going to get sent to the lab, so that's why we need it perfect. So we evaluate that. The lab slip's here, so you're going to put that together over there. Now we're going to put this on the teeth, have the patient bite together, because now this is going to show the lab. This is how this patient bites together. So it's going to look like this small. And that takes about a minute. That looks good. So the lab's going to fabricate this. Okay, the upper jaw, the lower jaw, and exactly how they bite together. This one's posterior, but it'll look the same. Okay, so all impressions are done.
So we did our bite ridge.
Yep. Put some dry in the mouth because that stuff, everybody wants a clean, fresh mouth. At this point, this is going to be separated in our lab. We're going to fabricate here in a minute, but we're going to fabricate a temporary crown. Temporary crown, please put Vaseline around your prep. Yeah, I'm going to make a crown real quick. So I'm going to show you how fast this is to make. So you want to make it pretty fast. It's during this appointment. So I'm going to make sure you put it in the right tooth. This is acrylic material. This is, if your office has this type of material, you'll make crowns fast. But the way we're going to learn here is the old school way, is mixing powder and liquid. We're going to mix powder and liquid, so you know how to do it the old school way, just in case you don't have this on stock or whatever. So we're going to Vaseline the tooth, because if you've done a build-up, they will bond together. So you always want to make sure that your patient will be biting. In his case, it's kind of hard for him to bite, but the patient should be biting. We'll wait for this to get hard. So this fabrication is done right here in the chair. And then I'm going to prep everything right behind my patient. Saved a little bit of material on my tip just to make sure it gets hard because I can't see it. I don't want to pull it off prematurely and then I don't have a crown. This material is getting a little harder with patients who have heat. Every patient has heat, 96.8 degrees, but he doesn't, so it takes a little longer for Dex. For this? Yeah. If you have the quick mix, it's about 2 minutes. So now I'm just trying to carefully get my temporary crown out of here without destroying our prelim. All right, and I got my temporary crown. I'm a little more advanced. I can use my high-speed handpiece. You guys will start off with your slow-speed acrylic burr. Turn off the water. I'm done. I'm gonna try it in. What do you think? Doesn't look bad, huh?
Yeah, it's on the margin.
All right, so my crown, my temporary crown is fabricated. We're gonna try it in. We'll put it in. We gotta make sure we have our checks. So we have 3 checks. Our first check is gonna be our contacts first, because if it's too tight, it won't go all the way up. Contacts first.
Oh, lost. Oh, I wasn't in there wrong. Sorry.
So my assistant's gonna assist me when I put my floss there. She's gonna hold my crown. I'm gonna check for a click. Both mesial and distal. Contacts feel great. Oh, right here. I'm a hoarder. Now I'm going to check my margins with my Explorer, make sure it's even. So what that looks like is if I put a hat on my head, this is my margin, remember? So the edge of my margin, my crown should go up to there, and when I use my Explorer, that should be even, right there. So everything should be smooth or 1. Okay, margin on the facial looks good. Margin on the lingual looks good. Then we want to check our bite.
So, how would I pass this? This way?
Yep.
Okay.
Patient's going to bite, and then we're tap, 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 grind, 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 and then lower jaw is going to push out. Check our bite. If anything needs to be adjusted, we adjust it since it's temporary and not glued in. So we'll do all of our adjustments for our bite if we need to. There's a little piece here. Oh, break myself in the face. Okay.
I'll get ready with the temporary cement.
Okay, first thing you're going to do though is pass me a spoon so I can remove my crown.
Crystal, this is a bag of 500 from eBay. Wedges, you're in charge of them. They're all yours.
Okay.
Okay?
All right, so, morning. So pop off your crown with your spoon. We still have our tooth isolated. Sorry, I didn't clean up my patient. There's a little bit of material in his gums. There we go. Any material in the gums are going to make those gums hurt or tooth hurt. Could cause an infection, so make sure you clean up your patient. Okay, ready when you are.
Okay, so when I first cement, I got a Carlos.
So to mix cement is equal parts with temporary, so the same size, diameter or squeeze or however you want to. Patient stay open. Yep. So it looks like this. Catalyst, we have a catalyst and a base, and then she's going to mix it together. Oh no, use your Woodson. Make sure we get a spatula. So we deviated a little bit. We're not using a spatula, we're using a Woodson because the spatula is not present. But you should want a spatula to use. And when you do a spatula, you're going to do the whole spatula and you're going to smash and making a figure 8. And then lift up, smash, making a figure 8 to mix. And then go the other direction. So you're going to horizontal and then you're going to go vertical. Okay? Figure 8. You're good. Go ahead and add it to my crown. And in this case, we don't add it to my crown because I really don't want to temporary cement Dexter. So she's going to add it to the end of a cotton roll.
Smooth it on like butter.
Yeah, put it on like butter. Now, if you like butter, then you have to clean up a lot. So if you like a lot of butter on your toast, you're going to be cleaning a little bit because once I push that crown in, it's going to squirt out. So just a little bit of butter. So she's going to pass me a crown with the cement inside, but we're pretending here like we have cement inside. All right. First, I'm going to push really hard because I need it to fit that shoulder. And I want to make sure it's on good. Then you're going to pass me cotton roll to bite on. Because we're going to wait for the cement to get hard. So patient's going to be biting. Okay, time lapse, 3 minutes past. Cement's hard.
And now we're going to clean the cement.
Now we're going to clean the cement with an Explorer while checking the margins. So the doctor's not going to get this instrument without checking what he needs to check as well. We have to check the margins again because this time we added cement on the inside of the crown to change everything. So remove cement. Now she's going to plastic floss. This time we're not checking the contacts. We're actually going to slide a knot through the gingiva to loosen any interproximal cement. I'm not going to pop it down. I'm just going to pull it through. Last thing, check the bite. Tap, 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 grind, grind, grind. Then lower jaw excursion.
Okay.
Check the bite. Bite looks good. How's it feel, patient? Feels really good. Please remove all the cotton rolls. Give them a final rinse. All right, and then we have post-op.
Hi, Dex. So your provisional plan has been placed. You may notice some tenderness. Go ahead and rinse with warm salt water if that continues. Try not to eat anything hard or sticky, like gum, bread, peanut butter and jelly sandwiches, things like that. We don't want to loosen that crown. And if it does come off, come back, see us. We'll get you fixed up and like 5 minute appointment. And when you floss today, try to pull the floss through the tooth instead of going up and down. And yeah, do you have any questions?
None.
Okay, great.
Most important part is make sure you tell your patient he's going to be numb, and you're going to give a large time frame. 2 to 4 hours is a perfect time frame, because if you say you're going to be numb for half an hour and he doesn't become unnumb for half an hour, you're going to get a phone call, or an hour, or 2 hours. You got to say about 2 to 4 hours. If you want it out faster, go for a run, because your body metabolizes it. So if they ask that question, so it's metabolized. Next important thing is sticky and chewy foods. Please give examples, because you could say sticky and chewy. Well, did you know peanut butter and jelly sandwiches are sticky? And those seem soft. So you have to give examples to those, because if we do a regular sandwich with meat, now the bread is sticky and the meat is hard. So that can also pull the crown off. Almonds for sure, carrots, apples, anything that we bite here will break that crown, and then they'll keep coming back for 2 weeks to refabricate or re-get a new crown. So it's a pain, and he'll hate it. He'll start hating coming to the office, because don't forget, they gotta work. You know, they got kids to take care of too, so coming back and forth to the office is hard. So make sure you tell them, try not to eat your apples for 2 weeks, especially with the front tooth. The back teeth, we want to say, like from sandwiches, almonds, Laffy Taffy, yeah, things like that. So because the hard will break it, sticky will pull it off. Yes.
So is it for 2 weeks that they have to do that, or just like
2
their
weeks.
next appointment?
Yeah, 2 weeks.
2 weeks.
Yeah, they still come though. If this crown is ever removed, they have to come back, because if they walk around with the nub, we're gonna call it a nub. If they walk around with the nub, the teeth on the adjacent side will start moving in. So now when we did our final impression to it being out, the teeth moved in. Now this crown will never fit. So it protects the space, protects the tooth, and also gives aesthetics, especially for the front. Okay? So they have to have this on for 2 weeks. If the tooth is vital, trust me, your patient will be back to get a temporary crown on, because he feels everything. He feels cold. He feels hot. He feels air. Because it's a vital tooth. If it's a root canal treated tooth, they probably won't feel anything. Well, they probably just want their tooth to be covered. Okay, so those are the same differences between a vital or non-vital tooth. Any other questions? What else would we say? Oh yeah, flossing. That's another important step too. Make sure you tell them how to floss, because when they go home, Whether it's a back tooth or a front tooth, they're gonna floss the way they normally do. Or, let's say they don't floss at all. Then they're not gonna floss. Anyway, we need to keep that area clean because they're coming back. Well, we gotta tell them there's nothing gross than pulling off a temporary crown with a bunch of food around it. You're gonna be like, oh, throw that down real quick, you know? It is kind of disgusting, so you always want to tell them to keep it clean. Some patients are really good at keeping their mouth clean. Some patients really don't care, so you got to still talk to them about flossing and cleaning each and every time because it's beneficial for them. Flossing, they still have a natural tooth, but that's the natural tooth. Blue tooth, still natural. So the only thing that's sitting there is the hat or the crown. So anything underneath it will get decay as well. And if that gets decayed, then the crown ain't gonna last long. It's gonna break, and they're not gonna have it. So then we go into different type of treatment, probably more money, extraction, root canal. So it just depends on what we're doing, okay? That's it. Any questions regarding